Hello, and welcome to Awaken, where we share insights to the connection between science and spirituality for self-discovery, joy, and freedom. I am your host and spiritual coach, Stephanie Rouch, and I am so pleased to be here today with Dr. Aleksandra Filipovic. She's an MD and PhD. She is a medical oncologist, a cancer cell biology, a PhD in cancer cell biology, the head of oncology at a US-based clinical stage biopharma, and a practicing clinician. So she is very busy and steeped in the world of providing care for people with cancer. She is an accredited whole health medicine somatic clinical practitioner and founder of the H.E.A.L Clinic, a place where whole body intelligence comes alive. H.E.A.L Clinic is rooted in the H.E.A.L technique, standing for health, empowerment, awareness, and love. This approach is dedicated to enhancing self-awareness, increasing self-esteem, releasing past traumas and psychological blocks, and reducing physical symptoms of disease or ailments. This model centers around integrative healing and a biosomatic approach, which implements flexibly structured questions and expansive experiential interventions of working with the mind, body, and soul through movement, word, breath, silence, and much more. And the aim is to promote inner empowerment for healing, as well as clear, realistic, and positive attitude in order to learn and implement new personalized skills for an effective, productive, and functional life. She integrates a whole patient-centered approach into all areas of her practice. Thank you so much, Alex, for being here. What an honor to have you as part of Awaken.
Thank you for having me. The honor is mine as well.
So let's start out with your origin story because you have such a powerful background, and even your current practice is 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 very intriguing, I think, to a lot of our listeners. Like, wow, you have done quite a bit in this world. So tell us about how it all began.
Well, as I like to say, in my very early years, I landed between a stethoscope and a pipette. And what I mean when I say that is my mom is a medical oncologist, and my father, who recently passed, was a medical nuclear physicist.
Mm,
So medicine and research have always been in the family,
mm,
and I grew up around it, with it, hearing it, living it, breathing it. It became second nature in many ways. And the family and the way of life and what was important opened a lot of doors and horizons for me on the one end. But then on the other end, also gave me an environment through which I experienced the other side of the coin, if you would,
yeah.
that ultimately allowed for my body to dive deep into the healing journey for myself. And as everything in life, I like to say, it's an integration in the end. It's really living the integration. I studied medicine, then I did a PhD in cancer cell biology, so very deep science, practicing clinician, working in drug development as well. And then there's this, call it other side of healing
Mhm.
that I had the ultimate privilege to dive deep into and continue to choose to dive deep into every single day.
Mm,
And then those two started integrating
mhm,
and ultimately gave birth to the H.E.A.L Clinic.
mm,
So it becomes a way of life. It becomes a lifestyle rather than something that I do.
mhm,
It's really more a way of showing up
mhm,
for myself, first and foremost,
mhm.
and then for the patients, the clients, and everybody else, personally and professionally.
Right. There is so much that I want to dive deeper into. And the first thing that I'm really curious about is this integration that you've talked about of how they're interwoven, because perhaps for a lot of our listeners, there's still a sense that science and spirituality are really separate or are opposing paradoxical forces. So, can you share in your experience how to connect them and what the benefit is of connecting them?
Of course. Science and spirituality are really just two sides of the same coin. They're aiming to answer the same questions, just from a different angle.
Mhm.
And what I like to visualize when I talk about this is a diamond.
Mhm.
So a diamond has many facets, right? And because a diamond has so many facets, the light gets to take these turns through the crystal that ultimately allows for it to shine in the best way that it can, in the way that it's meant to. This is no different.
Mhm.
These are just facets. These are lenses. These are filters
Yeah.
through which we get to answer questions,
Mhm.
through which we get to inquire and live and be and experiment and explore.
Mhm.
And it is beautiful when we just create some space, which this work is really all about, is creating some space
Mhm.
to allow for more than one truth to be true.
Ooh.
So this is the space that holds both and.
Mm.
I am by profession a medical doctor. I am not, my identity is not a medical doctor. This is my chosen profession, my calling.
Mhm.
And I firmly believe in great benefits of Western medicine. It has given us so
Mhm.
much good. And choose the higher power of your own understanding, something that is bigger than ourselves. That's something, whatever it is that you believe in, speaks through prayer, speaks through meditation, speaks through breath, but equally speaks through a medication
Yeah.
and therefore, or an intervention. So Western medicine holds a lot of good. And then it has also offered us an opportunity. It has given us a mirror
Mm.
to understand how far removed we have become from the ancient wisdom that we are now remembering
Mm.
that goes hand in hand. So it's a both and approach, not an either or.
Mhm.
And that gives us permission, re-gifts us the permission or remembering of the healing powers that lie within.
Mm.
And so that's why it goes hand in hand. They go hand in hand. They're not separate. They go beautifully together.
Mhm.
And sometimes they do travel together at the same time in parallel. Sometimes one will lead, the other one will come along.
Mm.
It's a gorgeous dance. It's a really, really beautiful dance
Mhm.
that requires attunement to self
Mhm.
from the standpoint of a patient or a client, requires attunement of the healthcare provider
Mhm.
to themselves and the intention of attunement to the patient.
Mm.
And if we create more practices, more healthcare givers who are willing to adopt this way of relating,
Mhm.
notice that I'm not saying doing, but relating,
Mhm.
then I feel that there is great potential that we will tap into and that we will unlock.
I imagine there are so many aspiring healthcare providers that want to practice in this way. And
Yeah.
you're creating a model and a path for how to do it. So this is really exciting. I am I want to dive into this point about the importance of attunement to self
Yeah.
because across the series, one of the main themes that has come up is how self-love is a path to service and is a sacred and virtuous form of love, but can perhaps feel a little bit confusing or not accessible to people who are really open-hearted and used to being in a more self-sacrifice type position, especially healthcare providers. So, can you talk about the importance of that attunement to self that you're mentioning?
Yes, and self-love is everywhere right now. It's a buzzword. It's one of the newer buzzwords. So, and I fully understand the questions. What does that mean? What does that actually mean? Because if we just say love,
Mhm.
it really isn't it isn't a noun. It's actually a verb.
Mm.
It genuinely is a verb. It is a verb with an intention and with continuous assessment and readjustment. And love doesn't mean that everything is good all the time. Love doesn't mean that everything flows all the time, but it does mean that you have the bandwidth to remain regulated as much as possible,
Mhm.
moving through whatever life looks like
Mhm.
with sovereignty and
Mhm.
autonomy and choice,
Mhm.
and really putting that core security at the forefront. And what that can look like for some people is not going outside of themselves, seeking answers and advice from 100 different people
Mhm.
or from 100 different doctors
Mhm.
or from 100 different friends. It is also about being able to really tap in to the wisdom that lies within the body.
Mm.
So to me, self-love is that really just being able to connect to your own body,
Mhm.
to learn the language that it speaks,
Mhm.
and then to know what to do with it. And it's a practice.
Yeah.
It truly is a practice. It's a muscle that we build. That our nervous system sits is front and center in this process. And what I do in the clinics now is really work with the nervous system to
Mm.
understand where it's at, what is the state, how does the nervous system move through the states, what are those chosen ones. We often hear fight, flight, freeze. How does our body choose to speak to us? Is it through pain? Is
Mhm.
it through symptoms? Is it through change? Cancer being one of the ways that our body can speak to us.
Mm.
How can we ask a different question?
Mm.
How can we create that space? How can we be okay with not knowing for a certain period of time? Can we try to find wisdom and magic in that place of not knowing?
Mm.
What that requires is a relationship to be built between the healthcare provider and the patient or the client. These are times, especially when it comes to oncology, where there's a diagnosis at hand or there's treatment that is starting or a patient's moving through, is in the middle of, or is coming out of, and perhaps there are side effects and such. It can all feel very urgent. And I'm not by any means minimizing the seriousness of these situations.
Sure.
What I'm offering is that there can be something else present. There can be more than one voice.
Mhm.
And if we allow for that something slightly different to be present in this space, the gifts of that will unfold. And that ideally, what we want to do is build a relationship between the healthcare provider and the patient or the client where they become re-empowered
Mm.
to choose what's best for them
Mm.
in that given moment, fully aware that they have every right to change their mind, to query, to ask, to doubt, to celebrate,
Mm.
to acknowledge the hardship. What I like to tell my patients when they come is all of you is welcome.
Oh, wow.
All of you is welcome because they are.
Mm.
For so many years, you have 10, 15 minutes for a patient if you're lucky.
Yeah.
And there's seemingly only so much you can do with that time, within that frame of time. What I teach colleagues now is that perhaps that is one way of looking at it. But there's also another way of looking at it, where there is so much you can do in a minute, or
Mhm.
even 2 minutes, 1 minute of real attunement. There is so much magic that can happen in a minute.
Mhm.
And I say that with such deep confidence because I witness it day in, day out. You don't need half an hour, you don't need an hour and a half. And those are the magic happens in those small moments, in the instant,
Mhm.
if you allow it.
Mhm.
And we can all do this. We really all can. The benefits for the patients is truly immense. And and for us, it's incredibly rewarding. It completely shines a different light on the practice and really reminds us what being a doctor is all about.
Mm. So for those who are in healthcare right now or are in some way providing care and perhaps do feel that stuckness of like there's just not enough time for me to give this, how, and you're offering, you perhaps use a 1 or 2 minutes to have this attunement. Can you speak to like what that looks like or what cues the provider could give themselves in that moment to get to this place of attunement?
I think curiosity is a beautiful virtue
Mm-hmm.
that serves us well in this intention.
Mm-hmm.
So get curious would be my best advice. Get curious. Get curious about something other than the tumor itself.
Mm-hmm.
We get really curious about cancer.
Yeah.
So I'm going to use oncology as an example. This can be applied to any medical discipline.
Okay.
But we get really curious, doctors will take a biopsy, a sample of the tissue or a blood sample, and then we're going to analyze it backwards and forwards, use very, very fancy and important tests that do tell us a lot. They really, really do. They're highly valuable. But we get really curious there. Well, my invitation is to get curious about the person.
Yeah.
And this can truly take just a minute.
Mm-hmm.
So the one question, if I can offer anything, is one question that you can ask your patients is the following, and it's important how you ask it. Anything that happens to us, and let's say that it happened today. Well, whatever it is, could have happened 2 weeks ago or 2 months from now,
Okay.
but it chose to happen today. Okay? It just happened today. So we may not really know why it happened today, but the invitation is to get curious and to say, look, you may not know, I don't know certainly, and it may not even matter, but let's get curious, you and I. And if you were to guess, why now?
Huh.
So that question, why now, holds so much potency.
Mm.
First of all, it's an open question.
Mm-hmm.
It's an open-ended question. And often there's going to be time to get the answer.
Mm.
So the next important advice is be okay with silence
Mm-hmm.
until the answer comes.
Mm-hmm.
And perhaps offer a reassurance saying, just guess. It's
Yeah.
really not important. But if you could guess, just guess. You don't have to know. Guess. Why now? And then often what will happen is the answer will come in a form of a question back to you, back to the healthcare provider. And it can sound something like, well, gee, doc, I don't know. Do you think it can be because, and then the actual answer will come.
Yeah.
So let me give you an example.
Okay.
And this is an example from a teacher of mine, Dr. Steve Berman. So he had a patient, for example, who was supposed to have an intervention, a surgery, and had an infection just the day before the surgery was supposed to happen.
Mm.
His answer to the question, why now, was, well, gee, I don't know. Do you think it could be because it was actually my wife who really wanted me to have this surgery and I didn't?
Mm. Ooh.
Right?
Right.
Yeah.
Mm. Mm-hmm.
And then you start seeing the human side,
Mm-hmm.
and that there's a lot more, that whatever clinical symptom or sets of symptoms are presenting themselves, there's a lot more there that is deeply human, that is deeply relational, that is deeply emotional, and that holds a lot of wisdom.
Mm.
And that's the root cause. That's the root cause practice. It starts with a different question.
Mm.
That question can be, why now, if you had to guess? Another way is to really get curious about the belief system of the patient or the client. So I'll give an example from my clinic. A young woman who was diagnosed with breast cancer had a gene that can be associated with this diagnosis. That can be an inherited gene. It was BRCA2 in this instance.
Mhm.
Her dad passed when he was young as well,
Mm.
and he also had the gene. He passed from pancreatic cancer. So my question to her was, do you remember by any chance what your 10-year-old self told herself, her own self, when your dad passed, when you were 10? And she said, oh yeah, I remember very clearly. I said, okay, well, what was it? And she said, well, I told myself that I too would get cancer.
Mm.
Now, I'm not saying this is the direct cause.
Right.
What I'm saying is there's more there than meets the eye.
Mm-hmm.
There is a deeply personal and human aspect that we as doctors and anyone else in the healthcare space, we actually have a profound privilege to bear witness to that.
Mm.
It is a humbling experience. It is a privilege to hold space for the human self to come forward. And that is what the work is all about.
Mm. Well, as someone who has family members who have passed from cancer and friends with cancer, I am so grateful for the work that you're doing because this is something that affects all of us to some degree on a personal level. And there's there's a need to be seen as a human with the diagnosis as well. So I just think it's phenomenal work and it is very it's inspiring and it brings a lot of hope as well. So thank you for sharing and listeners, check out Alex's work here because this is some really good stuff.
Thank you, Stephanie.
So you're welcome. So would you be willing to guide us through an experiential exercise that addresses any of these components of attunement?
Sure, I'd be happy to, of course. So this is going to be a really quick tune in,
Okay.
and I would invite everyone as they're listening, if they can in the moment, to find a very comfortable space if they can, to be alone.
Mm.
And if that's not possible in the moment when they're listening, then perhaps pause and listen a little bit later. It would be lovely if people could close their eyes, only if they're comfortable and safe to close their eyes. So if you're driving, operating any heavy machinery or anything that is unsafe to close your eyes around, again, just pause, do this later. It's only going to be about 3 minutes. And before we dive in, what I would like to say is there is a truth that healing is available to all of us, and it can also happen in an instant.
Mm.
Now, I've been in this space a while now, and I still have moments where I grapple with that.
Mm.
And that grappling tends to be some form of resistance.
Mm-hmm.
Some form of resistance. Because whatever our body chooses, and this is one of the profound truths that I have found in this work, through this work, it does so with the best of intentions.
Mm.
There is nothing that our body does or shows that is meant to be against us. It is all meant to serve us, and the body works in the best way that it knows how in the moment.
Mm-hmm.
And sometimes that's a symptom.
Mm-hmm.
So really getting curious about, why now and what's the message, learning the language, but then also really getting curious about what am I getting in this way that I am not getting in a healthier way? Like, is there a healthier way to meet a need than through manifesting this particular state or symptom?
Mm-hmm.
Is there a different way? And so this exercise is really going to be an intention to connect to the most healed version of ourselves, because that version exists. It's already there. It's already healed in whatever way healing looks like, because healing doesn't look the same for every person. And healing does not always have to equal cure. So we will tune into what does healed mean in this moment to every one of us, and see if we can get a message from the most healed version of ourselves.
Great.
Yeah? All
Yeah,
right.
do it.
So with that, I'm going to invite everyone to find a comfortable space. Feel free to sit down or lie down. Close your eyes if that feels comfortable for you. And just breathe normally, as you normally would. Just draw attention to your breath and notice that there's air entering your body through your nose or through your mouth, however you're breathing in this moment. Just notice that there's air entering your body. And as you're breathing, ask the air that's coming into your body to create some space where your body needs it the most right now in this moment. And see if you can feel where this space is emerging. Can be in any area of your body. Just notice. Just notice where the air wants to go and where the space is most needed. And with your next inhale, as the air is entering your body, ask to be connected to the most healed version of yourself that is available for you today. And notice how he or she chooses to come forward. This can be an image of yourself at any given age, past or future. Perhaps you know that it's you, but it doesn't quite look like you, and that's okay too. Maybe you see it as a color or a texture. Perhaps it comes as a body sensation or in a change in the way that you're breathing. But also you may not feel anything at all. And I invite you to trust that. Just send out an invitation to the most healed version of yourself in whatever area of your life the healing is most needed. It can be physical or non-physical. Allow that the most healed version of yourself enters the space that you have created. He or she may come now or later. It can be minutes, hours, days, or weeks after this process. Just allow. And if you've already established that connection, if there is a glimmer of the most healed version of yourself already there, or for those that will come, allow yourself to notice what is different between you today and the most healed version of you. Perhaps notice how near or far the most healed version of yourself is. How is he or she moving? What's different? And with the next breath, ask a question. What is the next right action for me to take to get one step closer to the most healed version of me? What is the next right action for me to take to get one step closer to the most healed version of me? And see what comes through. Trust what comes through. This is your wisdom speaking. This is your knowing. You know. You already know. Just let that drop into the space that you've created. And if the answer doesn't come straight away, just set the intention that the space that you have created remains open for the answers to come and for the most healed version of yourself to start taking residence within you in that space. And as we're slowly completing, know that you can always come back to this. This is your space. This is all you. This is your power. And give gratitude to the experience and the answers that may have come and those that will come. If you feel comfortable, perhaps put one hand on your heart and one hand on your belly. Hold yourself for a moment with the words, I am safe. I am loved. I can be healed. And as you're taking the next breath, slowly wiggle your fingers, wiggle your toes. And when you're ready, open your eyes to the room. Welcome back.
Thank you.
You're so welcome.
Thank you for sharing. So for those who would love to continue, I know you're offering some free gifts, and can you tell us about that and how people can stay in touch with you to further this work?
Of course, thank you. Yes. So your audience and your community will receive a couple of gifts on the day. So we will have a couple of practices. One of them is called the Healing Roundtable, and it's really a beautiful way of taking inventory about who is around us in our life that supports us or not, and how can we get really honest with ourselves about what we truly need when it comes to our support system. And this can be oriented towards health or anything else in our lives. And it's a practice that we can keep revisiting. And then the other practice is going to be a form of a journaling exercise that can take place over a couple of weeks or even longer than that. It is really an invitation to become more aware about specifically the language that we use when we talk to ourselves. And this time it's going to specifically be oriented towards health conditions.
Mm-hmm.
Symptoms, diagnoses, anything of that nature. It really is meant to offer a landing page, if you would, to put on paper that which we hold in our bodies or in our thoughts, in our minds, that unbeknown to us can really affect us. And I'm going to be offering gentle advice on how we can shift that narrative, the medical narrative that can be really, really powerful, and watch how that transforms, even within a space of only a couple of weeks.
Mm-hmm.
Profoundly transforms our inner world.
That is fantastic, super generous, and make sure to check those out for all who are listening to
Thank you.
take the next step with your healing and to support
Thank you.
others. Mm-hmm.
Thank you very much. Yes. And then for people who would like to get in touch, the website is www.thehealclinic.com, and I'm available there through the contact form. And I really do invite everyone who's interested to get in touch and to explore what's possible for them.
Great. Great. Thank you, Alex, for being part of Awaken and for doing this super important pioneering work of integrating science and spirituality in oncology and beyond. Thank you.
Greatest pleasure. Thank you so much for having me.
Thank you for tuning in to this amazing interview as part of our Awaken series. I hope you found value. Check out the rest of the interviews on Awaken. Keep tuning in, and please subscribe to Paradigm Expansions to stay in touch, where we are doing more events like this, and we are all about dropping in to your heart, to your true self, to really, truly love your life. Thank you for joining. See you on the next video.